Hello, and welcome to Freedom Keepers Senior Edition. This is the podcast where we reach out to all our seniors to stand up for liberty, love of country, faith, and family. And as you know, we're now working closely with Turning Point USA, American Families. This episode is going to be about insurance, cost of insurance. So that really affects American families. So, folks, the cost of insurance is going up every year. We're going to talk about different types of insurance, what's causing premiums to go up, some of the middlemen involved in the whole process, and current and active legislation and policy efforts. A large portion of this episode will be on Medicare and what this coverage provides. So listen in. One interesting fact I wanted to tell everybody about: insurance companies don't really make their money from collecting your premiums directly. Here's how it works. They collect premiums up front, then after a good deal of time or much, much later, they pay out the claims. So in there, you have a significant gap of time. During that time, they invest your premium money in stocks and bonds, thereby generating billions. And the second way they make profits, they keep claims payouts much lower than the collected premiums. It's a very lucrative business, as you can see. It's one of the reasons it costs a lot for us. So we're going to talk about current government efforts to curb this practice and help you, the consumer, later in this episode. Beverly, I know you wanted to speak to one of the most egregious insurance costs, and that's of health care or Medicare, right?
That's true, Irene. Thank you. And I'd like to welcome everybody for joining us today. Hopefully, you'll learn a lot about the insurances that we're going to be talking about, in particular Medicare Part A and B. Let's talk a little bit about eligibility. You have to be a U.S. citizen or a lawful permanent resident who has lived in the United States for at least 5 continuous years, and you meet the following criteria. First of all, you have to be over 65 years of age. Also, you can qualify earlier if you are someone like people with disabilities who have received Social Security disability insurance or Railroad Retirement Board benefits for at least 24 months. Also, another group of people that can receive Medicare are people with ALS, amyotrophic lateral sclerosis, that's Lou Gehrig's disease, or ESRD, end-stage renal disease, and that's kidney disease.
So are there other people who can qualify for Medicare?
Actually, there are a group of other people that can qualify. There was an act that was passed back in 1996 by our career politicians, I would like to say, that was called the LAPR. Any illegal person, any illegal alien that entered this country could apply for Medicare under this act. It was called the LAPR, which was lawfully admitted permanent residents. So they were able to apply for them. There are other people that can apply for green cards. If they entered the country legally through visas and their visa expired, they could, if they have to go through some red tape, but they can still apply for a green card, and then therefore they were eligible to apply for Medicare. I'm glad you asked that.
Okay. Mm-hmm.
Let's talk a little bit about Medicare Part A. Now, if you qualify for Part A, the premium is for free. If you pay for Medicare taxes for the past 10 years or 40 quarters, and that's while you were working. And a lot of people wonder, how do I qualify? How do I, collect enough money? Well, that's how you do it. It has to be the 40 quarters while working. Now, if you do not qualify for premium-free Part A, you can still buy into it, but it can be quite costly. You have to pay a monthly premium, provided you're 65 years or older and you're enrolled in Part B. Remember, Part A is free because you're paying for it through your taxes. Now, Medicare Part B pays for 80% of the bill, and you're responsible for the other 20%. Now, this requires a monthly premium for everyone. So when you enroll in Social Security and you become eligible, you're automatically enrolled in Part A and B. But you can choose to opt out of Part B. I don't think a lot of people know about that. So in 2026, the standard premium for Part B is $202.90. And this is automatically taken out of your Social Security check. Now, this $202.90 only applies to those individuals that are making $109,000 or less. Or if you're a couple and you apply and the both of you are making $218,000. If you're married or filing separately, it's still the $109,000 or less. Anything over $109,000 is figured accordingly, and that can be quite expensive. Now, if eligible, you can apply online at the Social Security Administration. That's My Social Security. I'll repeat, mysocialsecurity.gov. Ladies and gentlemen, go online and look at all the benefits that you can get and what some of these things really entail, because it can be quite interesting. So if you're not eligible for Part A, which is that free premium, you may not be able to buy into it if you or your spouse worked and paid into Medicare taxes. You either pay $311 a month or $565 a month, and you must sign up for Part B. So you see, Irene, it can be quite expensive.
Yes, it certainly can. And these high costs are really applying to all seniors across the board. So, Beverly, can you be more specific about what Part A and Part B of Medicare cover? It's important. So, everyone needs to be aware of this.
Certainly, I'd be more than happy to. Well, first of all, coverage for Part A, that's hospital insurance. This is the free part that the government gives you that you get out of your taxes while you're working. So it covers inpatient health care, and that includes a semi-private room, meals, medication, nursing, and operating room costs for up to 90 days. So I'm going to be specific about that. Skilled nursing, which includes room, board, skilled rehab or nursing care up to 100 days. Hospice care covers basic relief, symptom management support, services for terminally ill, provided you or your spouse is in your home or a hospice facility. This helped with my mother because they allowed me to get a home health aide, and they paid for 4 hours a day, and I picked up the other 4. So when I was working and my mother was sick and she was dying from cancer, I was able to have 8 hours of nursing care for her. So it really comes in handy.
Yeah. Hmm.
It really does. So home health care, it covers physical therapy and occupational therapy, and also intermittent skilled nursing. However, it doesn't cover custodial care, which is 24 hours, 24/7 care. Now, coverage on Part B. This is a coverage that you have to pay for. This is all of your outpatient medical care. And this is not funded by any payroll taxes. And this is the one that requires that monthly premium that we spoke about. There's certain preventive services that pays 100%, for example, flu shots, cardiovascular screenings, and annual visits are covered. And we also have to remember that in 2026, it is still $202.90, incomes under $109,000. I know I'm repeating this, but I just want to make that clear to everyone. It pays 80% for most medical expenses. And here's the little caveat, though. We have a deductible of $283 in 2026. But really, that's not that much money when it comes to our medical expenses. I laugh at that. I laugh at that. I read when I think about $283. It's not really that much.
Right.
But but it covers medically necessary services and preventive services. For example, doctor services to diagnose or treat your condition. You go to your private medical doctor, and it's paid for. I'll talk about copays later. And it also pays for specialists. There's also preventive services, for example, healthcare to prevent illnesses like the flu or detect pneumonia at an early stage when treatment will most likely work. Also, outpatient care, surgeries, procedures, for example, x-rays, MRIs, anything the doctor can come up with to try to diagnose your illness. Ambulance services, clinical research, durable medical equipment, limited outpatient prescription drugs, also covers mental health and substance use disorders. Uh, if you need oxygen, if you're on hospice or you're at home, you have a problem with your lungs, it pays for oxygen equipment and accessories. It also pays for part-time skilled nursing help. So there's also another thing that we have to remember that this Medigap or supplemental health care, this pays for 20% that Medicare doesn't cover. So you could choose a Medigap plan, which is the same as supplemental health care, that will help you pay for your deductibles, co-pays, and co-insurance. But it also depends on the plan that you pick because there's so many plans out there. So the most popular are F and G. F is no longer available because they're not giving it to new applicants. But if you have G, you can, that's a pretty good plan, but it's very costly. There are other plans available depending on your needs. So what you need to do, ladies and gentlemen, is look up Medigap comparison charts online at Medicare supplemental plans. This will give you a list of the most popular insurance companies that provide this coverage along with their cost. Premiums for the popular G plan, as I was saying, have skyrocketed. They've jumped from like 12% to 26% recently, and that's
Wow.
very, very high, really, if you
Yes.
think about it.
Yeah.
And they're increasing because of inflation, higher wages for healthcare workers, higher drug prices, and it's keeping most folks away from being able to afford the most essential of insurance coverages. I know mine in particular has jumped from 150 when I first joined up to 425, this year. That's exorbitant. And when you're
Yes.
on a fixed income, how do you make things, come together? How do you pay for food? How do you pay for the necessities? How do you pay for that? So what can we do, Irene? What can we do, all of us, to lower our cost of insurance? We have to shop around. We have to use that Medicare plan finder online, and we have to start looking at and comparing alternate carriers. Now, here's a good thing. If you're in good health, you may be able to pass a health questionnaire to switch to a cheaper carrier, and they're out there. And also, if you're in Plan G and you're paying, exorbitant fees because they keep going up, you can switch to Plan N, which has a significantly lower premium. And it also offers near identical coverage, and it requires a small copay. And that could be up to $20, which is insignificant, really, if you think about it. And the visits to the emergency room, I believe, are now this year $50. And you can also consider Medicare Advantage, but that's something else, and I'll talk about that later.
Yeah, well, thanks, Beverly. That's a great breakdown of all the costs and options for us. So keep in mind, folks, when we get that notification bombarded on the TV from October to, I think it's early December, when you can change your plan, pay attention, take a look, shop around, and that's where you can maybe get a cheaper policy. One of the things I wanted to talk about are there are middlemen who affect the cost of our health insurance, and a lot of people don't know about this. The biggest one is PBMs, or pharmacy benefits managers. And all of the companies, all the insurance companies use these. What do? The PBMs manage prescription drug coverage for Medicare Part D and Medicare Advantage plans, which are run by private companies. And all of them use PBMs. PBMs negotiate prices with drug manufacturers. They create the formularies that you look at to see if your drug is a covered medication and the tiers to determine how much you pay. They process claims. They process paperwork between insurance companies and pharmacies and payments. They also handle authorizations from doctors. Many of these PBMs own pharmacies, and they encourage you to use them. So there are some known issues and problems with these PBMs. For example, they were billing patients more for a prescription than the amount reimbursed to pharmacies by the manufacturer. They own the drug supply chain. They profit from setting prices and controlling pharmacy networks. They also influence which drugs are made available and exclude those with lower costs. So they pick the ones that are the higher price ones, and they don't even put the lower cost ones on the list for you that are available. And they make money from setting and negotiating prices and from pharmacy networks that they own, and they use them to dispense certain prescriptions. Here's another example. They may, and this happens a lot, they may negotiate a drug price with the manufacturer from $100 to $25, but they're still going to charge you closer to $100. And that's really criminal. So the government over the past year has stepped in. They give out penalties if they do or if they find any of the above mentioned actions going on. And from February 26th, there are new laws to make them more transparent, these PBMs, and they shifted them to a flat administration fee to reduce incentives that favored higher list price meds. They increased price transparency, and they're reducing out-of-pocket costs. So who are these PBMs? Who are these big money makers? They're 4 companies which are huge, and they hold 40% of U.S. health insurance market. First is CVS. I'm sure you all heard of them. Then you have Optum RX. You have Express Scripts, which is one that I use, and Prime Therapeutics. Those are the big money makers, PBMs. Now, you also have another middleman who's in there in the mix of all this called TPAs or third-party administrators. What do? They process claims. They manage employee benefits for the companies, for the insurance companies. And there's daily management and administration services for all the insurance plans. The largest in the United States are Sedgwick, which is one that I was involved with when I was still working, Gallagher Bassett, Crawford, UMR, which is United Healthcare, and I'm sure we've all heard of United Healthcare. Yeah. And Meritain Health, which is another one we've all heard about, is Aetna and CVS. So both PBMs and TPAs add additional costs to our prescriptions. Beverly, I know you wanted to cover another Medicare option.
Yes, I do, really. I'd like to talk about Medicare Advantage. This is the alternative to the original Medicare offered by private companies. It's not offered by the federal government. These plans bundle your Part A and Part B coverage, and they cover Part D prescription drugs, along with extra perks like vision, dental, and fitness programs. We've all heard of Silver Sneakers, right? Well,
Yes.
they cover that.
And they push these Medicare Advantage plans on TV quite a bit.
They do. They say, oh, man, it's wonderful. So most of these plans require you to use a specific network of doctors and hospitals. It's like an HMO or a PPO. And if you go out of network, it's going to cost you more money and you may not be covered. And you also have to have prior authorization, which is a pain in the neck, really, Irene. So, and also premiums, many plans, and this is the caveat here, this is like why a lot of people like it, because sometimes if you don't have to pay any monthly premiums, but you still must pay that standard monthly Medicare Part D premium that we spoke about earlier. So sometimes you wonder how these plans stay in business if they don't charge a monthly premium. Well, they get money from the federal government. And they can get anywhere up to $1,000 from the federal government.
Wow.
And yeah, and it depends on how much coverage they give you, these companies. They may deny certain things, and if they're getting $1,000 per person, then the more money in their pockets and the less in yours. I mean, it's not a great plan, really. It isn't. They really have to look into it. And so you have out-of-pocket limits. Advantage plans include an annual cap on out-of-pocket costs for Part A and Part B service. Once you hit this limit, your covered care is fully paid for by the plan. But these plans must cover everything original Medicare covers. So that's one of the things that everyone should know about. And the Medicare Advantage deductible. Now, this is a biggie. Most plans are set around $5,400, and it can be higher. And also, if you go out of network, forget it. You're paying for the whole thing. Drug coverage, Part D. Most plans include prescription drug benefits. And for Part D, The yearly out-of-pocket maximum is capped at $2,100. So some plans offer vision, dental, hearing, health club membership, as we talked about before, and non-emergency transportation. So what you really need to do, ladies and gentlemen, is contact Medicare Plan Finder online or Medicare Coverage Comparison Guide, because they'll give you all the information that you need that I haven't covered or Irene hasn't covered.
Yeah. And that coverage comparison guide is really good. I used it and saved myself quite a bundle on my prescription plan.
Absolutely.
Yeah, let me just talk briefly about Medicaid. So there are two types of Medicaid that you can apply for seniors, for everybody, neither of which is easy to apply for. Let me tell you. The first one is MAGI, and this is for those who are under 65, children, pregnant women. There is an income limit based on a percentage of the federal poverty level. So you can imagine how low that is. And you wonder how people can live on that kind of income. The second policy is ABD, or aged, blind, and disabled, people over 65. There's very strict income limits, $2,000 or less, and no assets whatsoever. And that also includes long-term care. So both programs are based on income. This varies in different states because the states control the Medicaid options, Medicaid qualifications. So New Jersey is very, very tough. It's very difficult to navigate or how to apply. And I seriously recommend you go through a social worker, or if you can afford it, a lawyer. My mother, years ago, this was like 10 years ago, I applied for her Medicaid. She had to spend down everything, proceeds from selling her house, everything, to get it down to 2,000 in order to qualify. But the lawyer, and it ended up costing me $5,000. But she did get it, and that was what taking care of her assisted living and memory care, where she was for about 7 years. So if you can get it, it is a good thing. Beverly, what do we know, or what do we need to know about our prescriptions?
What do we need to know about our prescriptions? Yeah, it's amazing because I have a story about prescriptions. I went to my doctor recently, and she gave me a medication, and she said, "This may not be covered by Medicare." And I said, "Well, I need the medication." So when I finally got to pick up the medication from the drugstore, they said, "Have you talked to your prescription plan about this?" I said, "No, why?" They said, "It's $400." I said, $400. I said, "What can cost $400?" I said, "That's absurd." I said, "I can't pay that." I said, "Is there any other way I can get that medication?" I said, "Are there any coupons?" I didn't know what to say. I'm in the drive-in trying to pick up my medication. They hand me this absurd amount of money, right? So she said, "Well, come into the," and she said, "I'll look for some coupons for you." So I went into the store, and she's going through coupons, and I'm there with about 5 minutes, right? So I said, "Did you find anything?" She said, "I can't find anything any less than $27." I said, "I'll take it." I said, "I'll take it. I'll take it." I think so many people don't know how to ask and just pay the amount that the pharmacy wants. I mean,
Yeah.
that's absurd. $400 and then right down to $27. Unbelievable. I wanted to share that with everybody because it's a
Thank you.
joke. But anyhow, Medicare Part D prescription plan. And this is drug coverage for Medicare beneficiaries. It's a federal program, and it's provided by private insurers. It covers outpatient prescription drugs, including brand and generic, but they really like you to get the generic. Most vaccines are not covered by Part B, and you have out-of-pocket costs, and they're capped at $2,100, and that's annually. Once you reach this limit, you enter the catastrophic coverage phase, and then you pay nothing. And a lot of drugs are covered under the drug plan, Irene. I can't name all of them, but some of them are anticonvulsants, antidepressants, anti-neoplastics, antipsychotic drugs, anti-retrovirals. You have a lot of your immunosuppressant drugs that qualify. And there's also specific self-administered meds like insulin and there's some oral equivalents of chemotherapy, of therapeutic drugs. I'll get that out. Chemotherapeutic drugs. Blah, blah, blah.
Yeah. I was talking how I did a comparison at the end of 2025 for my prescription plan because I was paying about $48 monthly, which all of a sudden was going to go up to 97 in 2026. I said, "What?" So I shopped around, chose another plan which is now $27 a month. So it does pay to shop around. Warren Buffett, and I think we all know who he is, when it comes to insurance, advises keep it strictly for risk protection, not as an investment. And all insurance programs, regardless of what insurance for what, they share common risk factors. Some of those factors are the location where you live, your state, your township, your age or the age of your car, if it's car insurance, your pet, or your house for house and, home insurance. Disabilities or chronic disease, current value of the car, your house, inflation, skilled labor costs are factored into all of this, and technology for repairs, treatment of illnesses, and cost of goods, the supply chain, spare parts, construction products, and your claims history. So all those factors go into evaluating what your premium is going to be. It's not like just one little thing. So, life insurance, everyone pretty much should have life insurance. One insurance that has remained stable over the past few years, though, is life insurance, even though the rates have gone up 8 to 10% every year as you get older. So, you need to shop around also for life insurance. Very good plans, highly recommended, are AAA. Ethos Online, which you've seen, we're bombarded on TV with Ethos. It's ranked very highly by Forbes. And Select Quote, that's the most popular, where you let them search for you. You put in some of your details, and they'll give you the best price on what's out there. And there are two types of life insurance. You can get term life, which is temporary coverage for fixed number of years, say 10 to 30, for example. And that is 5 to 10 times cheaper than whole life, which is the other type, which is lifelong coverage. And that's more like an investment, includes cash value that grows over time. And premiums for whole life are much higher. Although it's like an investment, you build equity and you have cash value. You can withdraw or borrow against it at any time. So you need to decide which works best for you and your present circumstance. Now, the other insurance I wanted to talk about was pet insurance, because I have pets. This has also increased in the past 2 years considerably. And they say it's due to rising vet costs. These veterinarians, I can't say the word.
You're like me.
They specialized in medical care, and there's technology involved with the care. And also, there have been a lot of corporate buyouts of animal clinics. I guess they feel it's lucrative. So an average cost for a dog, for example, for insurance is $43 a month, and a cat is $23 a month. I have 3 cats, so I have to pay for the cats. And the best companies, starting at about $9 a month, are Spot, which is the one I use, and I think they're terrific. The ASPCA provides insurance, and Lemonade. So those are the 3 highly rated in the country, and if you need them. And again, even with things like, I know we're not going to talk about car insurance, but again, you have to shop around. There are programs online you can shop around, and that's how I switched from my State Farm to Progressive, saved about $80 a month on that. So shopping around is really the best way to go. And believe it or not, folks, there is current active legislation and policy efforts by our government. So they are trying to do something to lower these costs. They're working on Medicare out-of-pocket caps, Capping Prescription Costs Act. There's a Capping Prescription Costs Act to make it $2,000 a year. There's a Healthcare Price Act, requires hospitals' insurance plans to publish their prices so you can compare all of this before getting care, or before, for example, you decide which hospital you want to have your care in. CMS, our Center for Medicare and Medicaid, part of the federal government, They have put in place rules to lower premiums, crack down on fraud, and increase state control over our health exchanges. There is something that already exists in law. It's called the No Surprise Act, and that protects patients from unexpected medical bills. For example, after emergency or after surgery, such as an out-of-network anesthesiologist, which we get all the time. I've gotten them because they're out of network, so they're going to charge a whole lot more. That's the unexpected medical bill. Or sometimes, if needed, an air ambulance after an accident. There is another effort in place which is called No Patient Left Behind. And that is very cool. It's a network of biotechnology innovators, investors, economists, healthcare professionals, and patients working together to support solutions that improve affordability while preserving the innovation ecosystem we all rely on. By the way, that this is an international effort, not just for the United States. So they also have initiatives going on eliminating out-of-pocket costs, preserving and expediting development of the cures we still need and researching them, ensuring drugs go generic on time, and inspire all countries to appreciate the value of medicines and contribute their fair share to incentivizing innovation. They're looking for cures all the time. So, folks, we need to vote for candidates who support these legislative initiatives. And by the way, I just wanted to add one thing. Regardless of how much we have to pay, our health system is still the best in the world. We get the best care, we get the best plans, and it's still, if you compare it to other countries, we really have a good thing going. Beverly, I know you wanted to say something else.
Well, folks, it's important you research which candidates support these current efforts to help us decrease the cost of our medical insurance. We need to get rid of some of our career politicians who seem to think that, we all have money that we can just spend it, willy nilly,
Don't
like
we
they
all?
do. Yeah, really, like they do. It's no, people like, I'm not going to go into names or anything, but we all, career politicians are on both sides, okay?
Yeah, yeah.
So, like I said, research your candidates, research who's going to be working for you. You can do that by looking at this website, KFF Healthcare Election Preview. That's KFF Healthcare Election Preview for the most up to date and specific candidates in your district. Please, please be careful that you don't vote for anybody that's a Democratic socialist. Just wanted to put that in there, Irene.
Thank you.
Okay. Affordability of healthcare has always been one of the top issues for voting in our elections. And with the midterms coming up in November, it's important that you get out and vote. Remember, do not vote for any Democrat who's talking about democratic socialism, because there's no such thing. That is communism. Thank you for being with us today. We certainly appreciate your support. Please subscribe to our channel and share it with your friends and family. And we'll see you next time with some very, very interesting hot topics. Take
Thanks,
care.
everybody. Goodbye.